Hello and welcome to Sensei Podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei Podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure to welcome Dr. Margaret McEntegart, the Director of CTO and Complex PCI from Columbia University. Margaret, thanks again for joining us today.
Oh, thanks Manos for the invitation. I'm really looking forward to the conversation.
Wonderful. Thank you so much. And, we're really thrilled you had a great journey from both sides of the Atlantic. So we're very excited to learn from you how things work and what you've seen in the similarities or not in the two parts that you've been working. But maybe give us a little background. How did you become interested in this field, complex and CTO PCI? How did you become into this and learned as much as you have now to become very proficient and excellent in teaching people?
Yeah, thanks Manos. So I did most of my training in Scotland in the UK. And as I was coming through my cardiology training, the time that primary PCI was starting in the UK, and one of the interventional cardiologists I worked for was a real driving force behind that in Scotland. And at the time that I came through as a general cardiology fellow, they merged the two big centres in Glasgow, which is the biggest city in Scotland, into one big heart centre. So it became a real hub where all interventionalists came together for the first time in the city. So my timing was really perfect. So I got involved with that from the very start. And then what happened was, because it was such a busy centre, I essentially got moved there full time as, I suppose, the first really dedicated interventional cardiology fellow in Glasgow. And I just spent 4 or 5 days a week in the lab, which was a new concept there, because at that time when you trained in the UK, you only really got to be in the lab maybe 2-3 days a week maximum even when you were training in intervention. So I then got this really fantastic concentrated period of training in the lab, really over a period of about 2 years, because they needed somebody. And even though I was early on in my general cardiology, because there was a need, I got to kind of front load my training, I suppose. And the chap there that was driving the whole thing was also the person that was interested in the most complex procedures. So I then got to essentially work with him most of the time and pick up, all the skills required for left main and rotablation and all the other types of calcium modification devices we had back in that time. So very early on, working with him, I realised that that was where I wanted to be. I wanted to be the go-to person in the group. I wanted to be the person that had all the advanced skills and be able to deal with anything that came in the door, really. So that really got me interested in it. And then I spent a couple of years there as an interventional fellow, by the end of which I was already lucky enough to be independent in a lot of the complex techniques. And I decided it would be good for me to do a fellowship somewhere else, just to get a different perspective. And I happened to bump into Marty Leon. Actually, he came over to be keynote speaker at the British Interventional Society meeting. And I got to meet him, and he said to me, we never get fellows from the UK. Why is that? And I said, well, it's because we have to take the American exams to be able to practice. So he said to me, if we offered you a fellowship, would you do it? So I said, okay. So I then spent the second year of my fellowship doing the USMLE, also while doing my fellowship, and then came to Columbia 2010 and did a year here with at that time, Marty, Greg, Jeff, and actually also at the time, I was thinking about this yesterday, and it was a really interesting time because it was the year that Crossbow Stingray came out. Sure. So I got the kind of very early exposure to the whole ADR hybrid algorithm thing with Jeff. And at the same time, it was also the year that Partner A and B were done, and that I was also training to do structural at the time. So I had this real kind of concentrated year of being exposed to the early TAVR work here and also to the Crossbow Stingray development of ADR. So it was really a really interesting year. And then I went back to Glasgow. They'd offered me a job in Glasgow before I came on fellowship. So I went back And the chap that had been doing most of my CTO, most of my complex training there, was doing a bit of CTO, but really just antiquated wire cases. And then I came back and decided that I would try and build the CTO program. So again, my timing was perfect because at that point, James Spratt, who's now in London, but at the time was in Edinburgh, which is the other big city in Scotland, he was already established really as the only real kind of comprehensive C2 operator in Scotland and the lead C2 operator in the UK. And him and Simon Walsh and Colm Hanratty, who were both based in Belfast, the three of them were really the main drivers of CTO PTI in the UK. And I was lucky to have kind of gotten to know them a little bit. So when I came back, they kind of took it on themselves to proctor me informally, I suppose, before that really became a big thing.
Sure.
So I would save up the retrograde and ADR cases, and usually James and occasionally the guys from Belfast would come over once every now and then, and we'd do like a full day in the lab and train. And just over the first few years, I suppose I was an attending there, I just built the program gradually and built my experience, and yeah, and that was how things went. And then here we are 10 years later.
See, full circle, right? You came and now back, and now you're back again. So fascinating. And again, it's I guess a tremendous kudos to you, because I'm sure it's not easy to go all these switches, right? You were in one place, you go to another place, back another place. So a lot of switches, but clearly you were driven. So what made you, because it's I'm sure personal toll and a lot of back and forth. How did you go through all this process? And was it exciting and fascinating, or was it stressful? How did you find all this process?
Yeah, it's an interesting thing to talk about and reflect on. I've always been one of these people that I see things that I'm interested in, and I tend to just follow my nose, as you say. I've never really stopped to really reason too much with myself about whether I should or shouldn't do things. I always think, well, that looks like where I should go, I'll go there. And I suppose that's kind of always taken me in the right. I've been lucky enough; it's always opened the doors and taken me where I wanted to go. But yeah, I mean, I think undoubtedly it takes its toll. I think coming on fellowship's a different thing because you're a bit young, you're 10 years younger, and it's usually for a finite period of time. Especially when I came on fellowship, I knew I was going back. So I knew I had a year to really intensively soak up everything I could. Coming back this time was a bigger thing, obviously, because I'm 10 years into practice. I've now become kind of the person that everybody goes to and looks up to do these cases in the environment in which I've been working. You've kind of got your network, and to lift yourself out of that and come to a bigger institution with all that goes with that, and know that you're going to have to some degree reestablish yourself in a different environment, and also relearn how to work in a completely different healthcare system. I suppose was something I had to give some thought to. I think though the opportunity that this job offered me in terms of further expanding and growing my skill set in the lab and outside of the lab, I think was very attractive for me. And I think also the platform, one of the big selling points that the guys here made to me when I came over to speak to them about the job was that they felt it was a really important platform for me, I suppose, as a female interventional cardiologist to take on and to try and I suppose bring a slightly different flavour on a bigger stage than on which I was operating before. And I think professionally for me that you'll be the same, Manos, once you get 10 years into your career, you start thinking about things bigger than the next case. You start thinking about other impact you can make and other differences you can make in the field. And I suppose I've maybe just got to that point now where I'm starting to think outside of the lab as well as inside the lab, and what impact you can have on training and bringing other young operators on, and creating a vision of what other people might think they want to be. So yeah, and I think even if I'm being really candid about it, I think that even as a operator 11 years into my experience doing CTO and feeling very confident in that role, still quite daunting to take yourself to a new centre, because there's a lot of expectation, isn't there, about what you're going to bring, and you're undoubtedly going to put that pressure on yourself to measure up to what everybody expects from you. I don't know. I think maybe some of it is to do with your ability to cope with that, and how you embrace that is partly to do with who's round about you. You know, your family and your friends, and also your kind of deep seated sense of yourself. I suppose. I suppose I've been lucky. I grew up in a pretty. I came from a very kind of normal background. My mother was a teacher. My father died when I was very young, actually. And my mother brought 6 children up herself, and we all went to state school. And she was very fiercely focused on education, so we all went to state-funded university places, and thankfully have all gone on to be very successful in our careers. But I think it probably gave me a drive, a determination, and a kind of deep inner strength, I suppose, and a sense of your own purpose that I suppose has carried me probably through my career to where I find myself now. You know, when I was leaving Glasgow, actually, the week I left, they had like a celebration, kind of sending off, I suppose, and they asked me about to reflect on where I had started and where I was going, and it was quite interesting to have to, for the first time, I think probably since I graduated in 1997 from university 25 years ago, to stop and think about that journey, and felt quite humbled, to be honest, about the key people in my life that had allowed me to go from where I'd started to where I've arrived. So yeah.
Well, I mean, clearly you took advantage of the opportunities and you learned. And having as you said, some of the best people in the world teach you that goes a long way. But now that you're, very established and very confident, do you still get anxious about cases? Do you feel you're learning, or now that cases are not that stressful, so to speak, anymore?
Yeah, that's an interesting question. I wouldn't say I get anxious anymore about cases. I think I'm very considered, much more considered. I think one of the things that comes with experience is you think more deeply up front about all the potential challenges and hazards of the cases as you walk into them. So I would say that I'm much more measured about how I approach cases, and I think that's probably true of all operators as you become more experienced in PCI. But a very, very, very strong feeling about properly planning your procedures. And often what I'll do is, if I've got cases coming, I'll look at the lists the week ahead, and I'll see what's coming, and then I'll have a quick look at the case, and then the day before I'll have a really, really careful look at the case and study the case quite carefully. Obviously the angiographic imaging, all the other imaging and investigations we've got, and then all the aspects of the patient themselves. But I like to ruminate on the cases, so often then I'll go home, and maybe if I'm going for a run or going for a bike ride or doing whatever, I'll be thinking about the case and think around all the potential options in the case and hazards and hurdles that we're likely to encounter in the case. So I've often kind of pre-thought the cases quite thoroughly before, and I think that takes away a lot of anxiety of a case. And also I think being realistic and pragmatic, it's sometimes about what you're going to achieve, so if you're going to go into a case that's essentially an impossible case, then you have to be honest with yourself and with the patient about what it is that you're setting out to try and achieve for that patient. And I think the most important thing is to try and always remain focused on trying to make the procedure as safe as possible, especially when we're dealing with CTO, where largely we're looking to try and improve a patient's symptoms and their quality of life. And I think it's important to strive as best we can to try and avoid significant risk and complications in those patients if we can. And obviously we need to embrace a degree of risk in the work we do, because that's the nature of the work, and the only way to achieve success in certain cases is in some way to embrace risk, but it's measured risk, and you have to have thought that through carefully as you approach these cases. And I think during a case, one of the big skills I think of a complex operator and a CTO operator is to re-adjudicate that during the case. You recalibrate where the risk is, so you're 90 minutes, 2 hours into a difficult case, and you maybe haven't progressed as far as you should have, and you're encountering problems you didn't anticipate. The ability to pause and think should we be persisting with this? Has the hazard and the risk rebalanced and against a successful outcome here, and not in favour of us? I think, as well as the agility as a CTO operator to change your strategy, you should also have the agility to be able to proceed on or to back away from a case when you feel the risk-benefit balance is shifting in the wrong direction.
Wonderful. And then obviously that takes a lot of time and experience. But for the students that you teach, the fellows, both in Scotland as well as here in Colombia, how do you actually select the patients or the fellows you want to train? Do you have any criteria? Is it more the drive? Is it their technical skills, their enthusiasm? What makes you think that this person is going to be a great operator? I want to train him and make him reach his goals.
That's a great question, Manos, and obviously timely because we're all in the process of recruiting the CHIP fellows for next year. So I think it's a combination of things. I think just like people that are high achieving athletes, you need something more than just the physical ability. You obviously need a certain level of physical ability, I think, to be and dexterous ability, I suppose, in our work to be able to function at a certain level. But beyond that, you also need the emotional intelligence and the communication skills and the academic engagement with what it is you're trying to do to be the full package. So usually when I'm looking, if I'm training fellows and I'm trying to identify who I think is going to be people who are going to be suited well for this field, I'm looking for all of that. I'm looking for somebody who can look at the patient and determine whether it's appropriate to take on a high-risk case in that patient. Is it appropriate in this 85-year-old woman with multiple comorbidities to be taking on this complex left main in this clinical presentation? So someone who's sensitive to that and can listen to the patient and adjudicate the appropriateness of what they're doing, but then obviously have the skill to execute the case, but also have, as I said earlier on, the kind of emotional intelligence and the connection with themselves to be able to know, and the courage in themselves to be able to know when you shouldn't be doing things or when you should be backing away from things. And I think that's important. I think also a good sense of your own limitation when you're training is really important, so to be able to know that there's a time in a case where you can't be at the front of the table and you have to be willing to stand to the right-hand side of the operator and learn. And I'll often say to the trainees, the two trainees that I've had here so far, who work, both with me and with Jeff, who I trained with, and Ajay. When I trained with Jeff, I spent a large part of that training standing to Jeff's right. And, I learned through that process that when I went back to Glasgow to then run my own CTO program, I knew how to think through the case and I knew what the next decision was from standing to the right of somebody who was doing that for a large part of that fellowship. And I tried to coach them a lot that you don't always have to have, at the early stage of your training and your practice, you don't always have to be the person on the left. Sometimes it's more important to be the person on the right and to kind of exercise the thought process and exercise your brain during these cases as much as it is to exercise your hands. So I think an engagement with that and an understanding of that is really important.
Perfect. And then in terms of the live cases, obviously you've done many live cases for all places. You're organizing CTO+ this year and all the planning that involved. What do you think about live cases? How useful do you find them? Do you get stressed out when you do them? What is your thoughts how to make the most out of live cases?
Yeah, so I still remember. I remember the first time I went to TCT, right, when I was a trainee, and I was sitting beside a colleague of mine watching live cases, and I thought, why on earth would you want to do that? Why on earth would you put yourself through that stress? This seems like a crazy thing to do. And then the next thing it comes along and someone asks you to do it and you think, okay, and then you do one and then you do another one and then suddenly it becomes something that you find yourself doing all the time. So what I would say is early on, it's pretty stressful. Because it takes a bit of time to get used to being able to work and listen and you educate at the same time. But there are some good tricks to it, I think. So firstly, when you start in your own centre. So start surrounded by people that you're used to working with that don't need you to instruct every single action during a case. So your own people round about you, and start with somebody who you've worked with regularly. So the person you scrub with, make it somebody you've worked with regularly. I would say, I think this would be a good way to start for your first 1 or 2 live cases. And the other thing I think is really important is to have a good plan for roles. So I always say when I'm doing live case with somebody who's not done one before, is okay, you're going to do the case and I'm going to take most of the questions. And occasionally I'll throw you a question when we're in a nice, comfortable part of the case, but just you concentrate on doing the case and I'll feel the talk. And I think that's a really good way to do it. So I think being structured in your mind about how you're going to do the case, and have a really good pre-discussion with the person to your right and the rest of the room, how the flow of the case is going to go. I think also trying not to overprove yourself, So the main point of doing a live case is to educate, it's not to show off. So you'll pick cases that are going to be educational for the people that are actually going to be watching. And then also that's less, early on, it's going to be less stressful for you when you know you're very capable of doing that case. So I think that's a good way to start. For me now, I think early on, undoubtedly, I was nervous. And I think when you go to places you've never worked before, with people you've never worked before, it can still be unsettling. And even in recent years, I've gone to places to do live cases where I don't feel nervous at all. And then you get into the room and you realize that things are not the way you normally would do them, or the dynamics of the room are funny, or there's just something that unsettles the energy. And I think with experience, you get better at realigning that and controlling the atmosphere and the dynamic in the room. So I wouldn't say that I get anxious, and I think the other thing is always to remember is if you can't complete a case, it's not the worst thing, as long as the patient doesn't come to harm. And as long as you've done what you were there to do, which is to educate people. I think it's just remembering that it's not about that. It's not about how you look to the audience. It's about getting the patient through the procedure safely and about providing education. Then I think as time goes on, you get less nervous about it.
Wonderful. And then what gets you going through this stress? I know there's a lot of stress everywhere else. Do you exercise? Do you read books? How do you kind of get your body and mind ready for these complex procedures?
Yeah, so I'm a big exercise person. So I learned fairly early on, as a junior doctor, that exercise was a great way to keep yourself straight. So even from when I was back doing my internal medicine boards and things, I used to come home from work and I would go running before I sat down to study, and I've done that really through my whole career. So I run a bike to work sometimes. I go to yoga. I'm a big yoga fan, and I do HIIT classes. And when I was in Glasgow, I swam. I still need to sort out a place to do that in New York. So I pretty much will exercise 5-6 days a week, and partly I think importantly to keep your body strong, because it's an arduous career. And even a few years into my attending job, I had some serious back problems that I was able to fix through yoga and Pilates. And even then, I was fit. So it made me really aware of the fact that to keep my body fit and strong was important to be able to sustain myself through the work. But even more importantly for me, for my mind, it relaxes me and switches me off. And I think subconsciously lets me process a lot of the stress that comes with the job. And I think I'm lucky. I don't really feel stress or express stress externally, but I think I process stress internally through my body, through my physicality. And I think the way to release that is to use exercise to do that. So yeah, so exercise for me is a big thing. One of the things about Scotland that I had to kind of let go of a little bit was the ability to go out after work and be in the hills and in the mountains. Hiking or running with the dog, and I'll find my way in places to do that here. But that was something that I used to love to do. And in addition to that, all sorts of other things. I love to read. I like to go to the theatre. This weekend I went to the Met for a wander around in the sculpture rooms for an hour or two. I enjoy that kind of thing. So yeah, anything that uses your your brain and your body in a way that distracts you from the stresses of work, I think is helpful.
Wonderful. And then what is the next step for you? And obviously you just took up a huge role and you're doing a great job on that, but what is coming next? So you're a very established operator, you're teaching people all over the world. What is the next thing that you want to do?
Yeah, so I suppose you're right. So I started here in April, so I'm just 6 months into the job. So I feel 6 months in, I've kind of finally starting to get a real hold on, because even, moving from the UK to the US, I've really had to relearn how the US system works, and even how the hospital works and how the office works and where the referrals come from and all these things. So it's probably taken me 6 months to really reacclimatize to that and understand again how to function fully and fruitfully in this environment. So I suppose now going forward, my next big thing is CTO Plus with the help of Adri, Jeff, yourself, Bill Lombardi, Bill Nicholson in February. So that's really probably my big focus for the next few months, is really trying to get that organised and make a good job and make that another great successful year of that fantastic meeting. And then in addition to that, I suppose grow the next generation of complex operators through the fellowship programs. And for me, I'm also, like yourself, very academically interested. So start to build some my research program here. So I had started a few significant pieces of work when I was in Glasgow, co-supervised PhD students, and started to run some small clinical trials. So I'm hoping to really get my teeth into that here. That was one of the other big attractions of this job. The biggest thing I've got coming next year is obviously the Empower study with Shockwave, the Shockwave for calcium modification in female patient study, which we're hoping to get off the ground. Myself and Alexandra Lansky are the chief investigators for that, so we're hoping to get that off the ground Q1, Q2 2023. So I think between that and wrapping up some research I had going in the UK and Europe and getting CTO Plus off the ground will keep me busy for the next 6 months, and then I'm sure there's going to be a barrage of things for me to be getting on with as time goes on.
Well, it's impressive. And again, great testament to all the things you've accomplished and the many more things to come. And as we finish up, just a few advice for people, especially actually for women, because unfortunately, as you know, we don't have that many women in the field of CTO PCI. I mean, there's Arasi Maran, Alison Hodke, Kearney, yourself, but there are not that many women compared with men. So any advice to people, and especially women who want to follow like your pathway and become CTO and complex operators?
Yeah, so I would say if you want to do it and you feel that you've got the right kind of qualities that allow you to enjoy it and you think you will feel fulfilled in that role, then you should pursue it. Don't be put off by things you might perceive to be obstacles, because everything is surmountable. And what I would advise is you seek good mentors. We're blessed in the complex CTO field with a lot of incredible mentors, and people that will support you, both men and women in the field. And I benefited from that enormously through the men that mentored me, my male colleagues through my training. So I think reach out to people. I think one of the great things about the field of CTO and complex PCI is people are very generous in their support of enthusiastic young operators. So yeah, I would say attend all the major complex PCI meetings, because that's where I learn my skills. I remember coming to CTO New York as a young operator, and you're really closely and attentively watching what was going on, and then going back to my practice and applying what I had seen in the live cases. So yeah, I think attend the high quality meetings. Use proctors. Again, people are very, very generous with their time to come and proctor you and support you to do cases. And if you use all these approaches, then I'm sure you'll succeed.
Wonderful. Well, thanks again. I'm sure CTO Plus will be a huge success as all other projects you are undertaking. And again, thanks for taking the time today. Thanks for your advice to young colleagues, and excited to work with you on CTO Plus.
Thanks, Manos.
Thank you for listening to the Sensei podcast.